The energy-based technologies, why are we using them? The 3 different causes of aging and how we address all of those things. That's part of like the roadmap that we lay out. And then, a trajectory and a timeline for when those treatments are appropriate.
Hi, I'm Katlin Cauffman with Diamond Accelerator, and I'm so excited to be talking today with Jen Bullock, nurse practitioner and owner of Illume Med Spa in Ashland, Oregon. She's also a key opinion leader for Candela. If you were just at their recent conference, you heard her speak. We are so lucky to have her here today. Hi, Jen.
Hi, Caitlin. Thanks for having me.
So what we're going to be talking about today is the Illume Method. And I don't even want to try to explain its awesomeness. Dive right in. Tell me what the Illume Method is and how it's delivering amazing results for your patients.
Okay, awesome. Yeah, so the Illume Method is essentially a roadmap that I take all of my patients through. And what it focuses on is using, energy-based technologies, using injectables like our Botox and our fillers, and then, the clinical grade skincare products to give people really, really extraordinary outcomes. So the Illume Method is essentially using education as the foundation of everything that we do, but we also are talking about using our energy-based technologies, our injectables like our Botox and our fillers and Sculptra, and then really good clinical grade skincare to protect people as they go through the process.
Okay, so I want you to take it back a little bit because I hear a lot of med spas that say, and they have all of those 3 things that you mentioned, right? But what do you think is the key? What do you think is the real difference that really gives you, your staff, and the people that you've trained really all across the country in recommending a comprehensive treatment plan that's going to deliver results for patients? What is that key difference, do you think?
Well, as a healthcare provider, working in aesthetic medicine is totally different than any other environment that I worked in before. One of the things that I noticed myself doing is people would come in and they would have an idea of what they wanted. Maybe they'd show up and they were asking for Botox, and I would give them Botox and they would leave, and I'd have, really no follow-up connection with them until they had their Botox the next time. And maybe if I noticed that while they were there that they were broken out or that they had hyperpigmentation, I would bring up and mention something to them about an IPL or about seeing our esthetician. But I felt like I really didn't have a structure or a plan to follow that worked really well for everyone. So a couple of years ago, we had Terry Ross come and speak to us and do some training with sales. And what she brought to my practice was something called an Aesthetic Interest Questionnaire. And what it is this questionnaire that the patients fill out, and it has everything, instead of just like, I'm interested in Botox, it has like a list of symptoms, right? Clogged pores or hyperpigmentation or redness or fine lines or wrinkles or, how long their lashes are, all the little things. And we were able to target it based on what we offer. And what I noticed is that it created the opportunity to have a really fluid conversation with the patients about what their concerns were. It took the pressure off of me to try and sell them something, because I've never been comfortable with the idea of selling things, right? And then over time, we really just developed this process of creating this treatment plan that allows me to introduce what I think is going to be the best, essentially a roadmap for my patients to follow, but that gets them everything that they need, introduces it to them. I provide the education at that time. We spend on average 45 minutes with each of those clients as they come in for their consultation. And then the next time I see them, of course, not everybody's gonna be like, yes, I'm gonna do my filler and my laser and my Botox, and they're ready to do it right away. But we've built the foundation, right? they know that these are the things that they need, and they know that they're going to do them at some point in that year. So it just creates a really easy transition. So when they come in for that Botox the next time, when I'm looking at their skin, I can say, do you remember how we talked about IPL? It's, fall, and this is where we start doing our series of IPLs. And it's just created a seamless way for me to, have that conversation and to continue the conversation. And what we found is that the patients are happier. They feel like they're being taken care of. They feel like I remember what we've talked about, that I am looking at them as an individual and looking at what they need when they come in. People tell me all the time that, if one of my nurses doesn't do the follow-up and doesn't notice these things, that they feel like that she's not caring about them, right? Mm-hmm. So it's something that we've built into the education, and then we leave ourselves little notes along the way. This is where the patient is on their trajectory. So every single patient comes in, and we know that they're going to be sent education about IPL when it's time, if they're due for one, where they're at as far as their filler lifespan. People are going to be coming in annually for their fillers, and they feel like we care about them because we know where they are at in their life cycle.
Yeah, I want to break down two things that you just said, because I really want to make sure people get this. So when you say aesthetic interest questionnaire, I want to make sure that everyone is perfectly clear in the sense of, this is not just the same old medical history paperwork that everyone fills out about, like blood pressure and medications and are you pregnant and are you breastfeeding? No. We're getting down to the nitty gritty of every possible pain point, emotional and or physical, that a patient could have, that you have a solution for. Because in the beginning, they might just think that they're coming in for 20 units of Botox, but then once they answer that question about maybe it's, intimacy or urinary incontinence or hormones or, tummy fat, whatever it is, right? That it then will allow you, it opens that door to have the conversation. So it absolutely is not in a day difference, and it's essential. It's absolutely crucial piece of paperwork that every single patient fills out, right?
Exactly. And the thing is that most of the people that fill that out say things like, oh, I didn't even realize this was something that I could address. Tell me more about this, right? And so a lot of times we do a lot of intimate wellness, and almost every woman over 40 has some sort of issue with, whether it's stress incontinence or some vaginal dryness, and nobody broaches those topics with them, right? So, even just introducing the topic is, it's super key.
And even if they've been a patient for a really long time, I saw a statistic just a few months ago talking about how that less than 30% of your patients actually know all the tools in your tool belt that you have that you could potentially help them with. And they're aging every day. They're exposed to sun every single day. So just because they don't need it right now, it's only a matter of time before they need essentially everything that you have to offer for them, right?
That's right. Yes. People tell me all the time because we do an annual update on the Aesthetic Interest Questionnaire, and they tell me all the time, oh my gosh, I didn't even realize you did this, even though we're consistently putting out content to them. Not everybody's opening their emails. They're not opening their text messages. They're not, looking at all the posts on Instagram. And so it is such a key piece of being able to identify what our patients are needing and wanting.
Yeah, and it also is until they need it, a lot of people are, even though you could be doing a fantastic job with your content and your education, until they need it, a lot of times it's not absorbed or received until they're actually in the market. And so I just think it's so great that you do that annually with them. Okay, the next thing that I want to ask you about, right, is okay, so once a med spa institutes the practice of an aesthetic interest questionnaire or some version of that, whatever they may call it in their practice, right, is getting the next challenge that I often see with med spas is getting the provider to actually use it. Like, it's crazy to me, but it's like they get so busy, then they're just like, oh, you're not pregnant. Oh, these are your medications. Oh, okay, we can go ahead and do your Botox or filler or whatever the appointment is scheduled before, right? So how do you position this with providers of why they want to use this, why they need to use this, and for that to really click with them?
Well, in my office, it's not optional. It is part of the intake paperwork, right? And then it's part of their 1-year follow-up. And really in aesthetic medicine, you're supposed to have an intake with a licensed provider, whether that's an MD or a nurse practitioner. You have to get clearance to be receiving the treatments in the facility, right? Because these are medical procedures, and really we just build it into that process. So they fill out their paperwork online before they come in, and then the paperwork that they're doing in the office is that aesthetic interest questionnaire. And without it, like, I can't even guide the conversation, right? Because I'm going to be using so much of what they give me to direct what it is that I want to talk about. And then also, people don't always check, like, oh, I have clogged pores or anything about skincare, but I always ask them, so what are you doing for skincare these days? And, they'll oftentimes tell me I'm using, CeraVe or Neutrogena or whatever. And then I kind of tuck it in as an opportunity to talk about why clinical grade skincare is better than what we're using over the counter. Because when we're in our 20s and 30s, maybe it doesn't matter as much. But as we start investing money into things like Botox and lasers and stuff, we want to protect their investment. And really, the whole thing with clinical grade skincare is it is better, right? And it's not that much more expensive to put somebody on a really good regimen. The products tend to last longer. They get people results that are worth the investment. And so we just kind of tailor that kind of stuff on in as part of the process. So when I'm teaching a nurse practitioner, it allows them to essentially have kind of a pass on the sales. And it's really just a fluid conversation that they can have with the patient that allows them to introduce what they need to talk about, right? So it should be almost like, a ticket to get out of the uncomfortable sales conversation, because most of us come from traditional healthcare practices. We're not comfortable trying to share, what we think we need to suggest to the patient, right? We think of sales as dirty and uncomfortable, and we really do. I mean, for myself, I was the same way. I felt like, it was unethical to try and sell what I offer. But over time, what I've realized is that it's unethical for me not to share what I offer, because over the years, people that have, come into my clinic, they'll go out and they'll, do a Groupon, or they'll get microneedling at, a salon or whatever. And some places are great, but some places are not great, and they're not safe, and there's secondary infections and scarring and, just all kinds of things. So I know for myself that what we offer is the absolute best in the industry and the absolute best anywhere around. And it's my duty to provide that to my patients and let them know what we have. If I don't, then I'm doing them a disservice. And so it kind of takes away that whole I'm selling something to I'm serving, right?
Mm-hmm. Absolutely. And when you're teaching your Illume method and you're really providing the people that you're training a roadmap, what is the approach that you're taking? So not only you as the provider, but your patients never feel like you're coming across as salesy. What approach are you really teaching people to take?
Well, first of all, education about why we suggest the things that we suggest. I'm super nerdy. I love the science. I love the research. And so when I'm talking to patients about IPL or BBL, I'm citing the Stanford study. When I'm talking about, why we're using Botox in this, prescription, why we really want to recommend treating all 3 areas, it's because the research is there. We know patients get better outcomes. They're happier. And so I use that kind of as the foundation. But then, the energy-based technologies, why are we using them? You know, the 3 different causes of aging and how we address all of those things. That's part of like the roadmap that we lay out. And then, you know, a trajectory and a timeline for when those treatments are appropriate. So, I mean, for me, the very first time I had Botox, you know, I walked in thinking I was going to have a result right away. I didn't realize that there was maintenance. And, you know, patients want to know what to expect. And if they know what to expect, then they can plan for it, right? It's not ever going to be a one and done because aging never stops, right? And I have people that come in all the time that are mad because they got a single syringe to treat a whole jawline and they don't notice a difference. And so just having like that laid out, we do a ton of like full face corrections instead of single syringe options, right? So just being willing to lay it out for what they need, when they need it. And, you know, it makes it easy for the providers too, right? This is where I know my patient needs to be.
My next question is, how are you able to get over, because when you're talking about energy-based technologies, injectables, medical grade skincare, I mean, like the price tag is adding up. And how are you able to get over that fear of asking for such, in essence, high dollars and feel really confident in the recommendation of your treatment plan? How did you develop that muscle?
I know. I think part of it's practice, right? But also believing in what I offer. I know that when I prescribe these things, I'm as invested in the outcome of the patients as they are, right? They are a walking billboard. And the patients that do the things that I recommend are ecstatic. They're telling all of their friends. They look incredible. They feel incredible. And we have this relationship with them, right? Because I mean, so much of this is relationship based. All of my patients are my girlfriends, right? And so, I mean, that's really a big piece of it. I believe in everything that we do. I feel really confident in my treatment plans, and I know that it's worth the money that I'm asking for, right? They are going to be happy when they follow what I recommend. And if they don't, you know, then if they aren't happy with their results, we offer, you know, we're probably one of the only clinics that offer some kind of a guarantee. And it's not really a guarantee, but it is. So if my patients need a touch up on their Botox, we don't charge them anything additional. It doesn't matter what the cause was, whether they had bad post-care, it doesn't matter. We offer a complimentary touch up if they need it. They are more likely to follow my recommendations because they know that I have their back, right? If they come in for filler and they need an adjustment on their lip filler, I will take care of that adjustment. It used to be that you'd have to buy a whole nother syringe and people were just kind of bummed out about their results. So we take care of that for them. We have a great relationship with our reps. I know that, you know, they're going to help support me with that if I need it. You know, if I do a treatment on somebody and they don't get a good result, I eat it. I'm going to go ahead and retreat them, right? Yeah. And so that's really a big piece of our process there.
Yeah. And I would imagine too, like just along the way, you've realized that you'd rather turn away business if you and the patient aren't on the same page as far as like expectations and what it's going to take to get their expectation than have an unhappy customer or patient at the end of the day. It's just not worth it.
No, it's not. It's always a painful experience if we have to go through that. And I feel like over time you get to a place where you kind of pick up on the weird stuff and get a good idea where there's somebody, you know, there's always a red flag. And it's, you know, sometimes we're not a good fit. You know, if somebody really just wants to come in and, you know, partially treat, I'll recommend, I sometimes refer them out to people I know that will do it. You know, or if they're, you know, super price conscious, I'll tell them what I can do within their budget. And if that's not, you know, what they're looking for, then that's okay too. I'm a lot less afraid of letting them walk out the door than I used to be. Right. So it's just, it saves us a lot of heartache in them too.
Yeah, absolutely. Okay. Let me ask you this last question. Is it enough training when you know, buy a new device and your rep comes and teaches you how to use that energy-based device, or you get your initial certification to be an injector. Your skincare rep comes in and, checks to see if you need any, to re-up any of your orders. Is that really enough education and training to get to the point in your career where you have confidence and combination treatment plans that are really going to deliver the complete experience, amazing results for your patients?
No. I probably spend more time and energy and money on annual education than anybody else in the industry, because we will never know it all, right? It's crazy to think about where I started. It's been almost 6 years now, and having to just like stumble through and, try and do the very best that I can with the, tools and resources that we have, and, having to seek out and search and find what I needed to fill in those gaps. Because what they give us in a weekend injection course is, barely enough to do anything with. It's scary. It's terrifying, actually. I have also brought in my own clinic, celebrity injectors to train my injectors, and, was so unimpressed with what they brought for my brand new injectors that it really was part of what drove me to want to create my own, injection training. And then we're also going to be branching into the laser stuff, because I feel like there is so much missing on the foundational level. And, we're essentially throwing people out there to start providing services, and they are totally unprepared. I feel like there's a lot of cattiness in this industry, right? Nobody wants to share information. Nobody wants to support people. And that's shifting and changing a little bit. But, I almost feel like that's kind of at the root of some of the poor education. Is it's like, oh, I'm training my competition. There is so much out there for everyone. We're on like the very beginning piece of the growth of the aesthetic industry. And my goal with our education process is to be able to create, a community where people feel like they have somewhere to come back to if they have questions, where they are not in, an emergency situation before they have, to find somebody to help and stuff. So yeah, no, there is not, enough education in the beginning. And you have to just be willing to make connections with people, train with trainers that, have like an open forum, that have Patreon accounts and, active Instagram accounts, and are willing to just connect with people. And that's really one of the things that we're trying to do with our little training program, is just to create a community.
Yeah, I love that too. I have so many clients just like desperate to talk with other med spa business owners or other, service providers that are high level, because it's lonely for them at the top, and where to turn to. And yeah, I do see in local markets, like the competitiveness, even sometimes created by the reps, right?
Right.
But yeah, I love that so much. And so, okay, so if someone wanted to learn more about your Illume method and potentially learning from you, we're going to go ahead and link up how they can get a hold of you in the future to learn about your advanced training that is going to be available to anywhere, right? And no matter where you're at in the country.
Yep.
Awesome. Well, Jen, thanks so much for spending some time talking with me today. I can't wait for other service providers to see this, and I hope that it's really good. They're going to take some big takeaways, right? Because I really feel like most med spas have all the tools in the tool belt that they really need to get amazing results for their patients. And they're really just a couple mind shifts and a roadmap away from being able to deliver a really exceptional results for their patients.